The COVID-19 pandemic continues to create stress and anxiety for many Canadians. Eagle News correspondent Cathleen Mae Pangan tells us why.
The COVID-19 pandemic continues to create stress and anxiety for many Canadians, particularly those who do not have ready access to the regular support networks. Through the Wellness Together Canada online portal, people of all ages across the country can access immediate, free, and confidential mental health and substance use supports 24 hours a day, 7 days a week. As COVID-19 activity continues, Canada is tracking a range of epidemiological indicators to monitor where the disease is most active, where it is spreading, and how it is impacting the health of Canadians and public health, laboratory, and healthcare capacity. At the same time, the Public Health Agency of Canada is providing Canadians with regular updates on COVID-19 vaccines administered, vaccination coverage, and ongoing monitoring of vaccine safety across the country. Since the start of the pandemic, there have been 1,394,145 cases of COVID-19 and 25,761 deaths reported in Canada. These cumulative numbers tell us about the overall burden of COVID-19 illness to date. They also tell us, together with results of serological studies, that a large majority of Canadians remain susceptible to COVID-19. As immunity is still building up across the population, public health measures and individual precautions are crucial for COVID-19 control. Thanks to measures in place in heavily affected areas, the strong and steady declines in disease trends continues, with current reported active cases 22,861, down by 75% since the peak of the third wave in Canada. With a considerable decline in infection rates nationally, the overall number of people experiencing severe and critical illness is also declining. Provincial and territorial data indicate that an average of 2,024 people with COVID-19 were being treated in Canadian hospitals each day during the most recent 7-day period, June 1 to 7, which is 22% fewer than last week. As vaccine eligibility expands, Canadians are urged to get vaccinated and support others to get vaccinated as vaccines become available to them. However, regardless of our vaccination status, it is important to remain vigilant, continue following local public health advice, and consistently maintain individual practices that keep us and our families safer, even as we're beginning to see the positive impacts of the COVID-19 vaccines. Canada's chief medical officers of health and other health professionals across the country are closely monitoring vaccine safety, effectiveness, and optimal use to adapt approaches. As the science and situation evolves, public health is committed to providing clear and evidence-informed guidance in order to keep everyone in Canada safe and healthy. Reporting for Eagle News, I'm Cathleen Mae Pangan. We live in interesting times.